Hello, my name is Kathy Silard, and I have the distinct honor of introducing Dr. Ann Brewer. Ann graduated from Brown University in 1971 from the University of Vermont College of Medicine, as well as Episcopal Divinity School in 1979. I guess that was a dual degree. She also received an MPH from UConn in 2005. Dr. Brewer completed her residency in family medicine at the University of Connecticut, and in 1993, she joined the Stamford Hospital Family Medicine Residency Program. Dr. Brewer was Associate Director of the Family Medicine Residency until 2014, and she became the Director of Palliative Care at Stamford Hospital at that time as well. Her medical interests include care for the underserved, geriatric patients, children, and adolescents, as well as global health and palliative care. Dr. Brewer has served in several community service roles for St. Francis Hospice and the Children's Health Collaborative. Ann participates in annual medical service trips with Health Horizons International in the Dominican Republic. Taking care of patients who may be near end of life and needing compassion and understanding is a gift and a real deep, caring passion that Ann has. She is someone who really cares about this group of patients that are often marginalized in the healthcare arena. At Stamford Hospital, Dr. Brewer has been a trailblazer in advancing this program and advocating for the relief of physical and mental pain and the stress of serious illness, therefore improving the quality of life for these patients and their families. What you may not know about Dr. Brewer is that she played on the first American college women's hockey team, ice hockey team, at Brown University. And she recently skated in the alumni games celebrating 50 years of women's ice hockey at Brown. Now that is quite an accomplishment. Ann, please join me. For your commitment to excellence professionally and within our community, the YWCA would like to honor you with this 2017 Brava Award.
Thank you, Kathy. When you called me last fall, my first thought was, oh no, what did I do wrong? Because a lot of times that's what those phone calls are about. I happened to be in my car at the time, and when you told me that I had been accepted as this honoree, I almost drove off the road. Because it's such an honor to be part of this group of women to receive this Brava Award and to help raise money for the mission of the YWCA. The mission of the YWCA, education, women's empowerment, justice, and physical activity as a component of lifelong health, is key to community development. These concerns have been a focus of mine throughout my work, particularly in educating medical students and residents, serving the underserved, providing medical care, and now doing palliative care with those people who are often marginalized. There are a lot of people who have supported me in my endeavors. I'd like to start by thanking my family, without whom I wouldn't be here today. My 93-year-old mother was supposed to be here, unfortunately. She ended up having to cancel her trip down from Farmington, where she lives, because of the blizzard yesterday. But I would like to shout out to her what an amazing role model she has been for me as somebody who valued education and pushed me when I didn't know what options were available and pushed me to really understand and pursue my dreams. I'd also like to thank my many teachers who have inspired and coached and supported me as I pursued my two vocations, medicine and ordination. My colleagues have also been sources of learning and support, especially for the last 20-plus years at Stamford Hospital, where I have worked with talented talented and dedicated physicians, nurse practitioners, nurses, pastoral care, support staff, and administrators. And for the last 3 years, I've had the privilege to work with a wonderful team on the palliative care service. Over the last 40 years, I have learned so much from my patients about human nature, the resilience and the vulnerability of the human spirit and body. The struggle of many people for social and financial security, for health, and for a better life for their children have touched me deeply. And I am concerned that for a lot of people, these goals may be much more difficult in the current climate. The practice of family medicine has given me the opportunity to accompany patients on their life paths as they try to live well throughout the course of their lives. I hope that my times with them on these paths has been marked by compassion and by respect for the dignity of every one of them. I've endeavored to see the divine in the faces of those I've encountered, and I believe that all of us are called to vocations that express such respect for the dignity meant for all people. Medicine has been my primary way to express my values in individual encounters and in promoting communities where people can achieve their full potential. Because recreation has been for me a key to maintaining some kind of balance throughout my life, I want today, as a pre-Title IX woman, to applaud the opportunities that women have today in both elite and recreational sports. I never thought I would see the day that women's sports would not only get support, as opposed to the days when we had to sell candy bars at the men's hockey games to raise money so that my women's hockey team could go to Canada for the few games a year that we had. And now the Connecticut Huskies, the women's basketball team, routinely sells out their arena. So I'd like to shout out to all those women who have pursued sports and made it feasible for young women to dream of achieving their potential in physical activity. And I also never thought that somebody my age would still be playing ice hockey. Thank you all so much. And to all of my fellow honorees and to all of you, I say thank you, and may you all be blessed with vocations that call out of you the very best. Thank you.